presentation that we have prepared for Nursing 306 for epidemiology. And what we wanted to talk about today was how physical activity may reduce the risk of the incidence of type 2 diabetes in both obese and abdominally lean men and women.
Obesity and lack of physical activity are among the most crucial risk factors associated with type 2 diabetes. Based on previous studies, increased level of physical activity can actually lower the risk of type 2 diabetes. However, only a few studies have examined the correlation of combined physical activity and obesity with the incidence of type 2 diabetes. The purpose of this study was to examine the independent and combined association of physical activity and obesity with the incidence of type 2 diabetes in men and women.
So in the hypothesis that was developed, the researchers provided a little chart or a web that had type 2 diabetes and the co-founding variables along with it. Some of the co-founding variables that are associated with type 2 diabetes are high blood pressure, smoking, sedentary lifestyle, being overweight, and high fat and cholesterol levels. So the method that was used by the researchers was following a quantitative correlational design. What a quantitative design is that it's a common research method that uses a methodical process used to collect and statistically evaluate information that has been measured by an instrument. An instrument is a tool that is used to translate the information gathered into numerical data. Correlational design, as the name implies, it tries to find a correlation or a relationship between two or more variables. In this study, the researchers wanted to examine the independent and the combined associations of physical activity and obesity with the incidence of type 2 diabetes in both men and women. The independent variable is something that can be manipulated by the researcher. And what the independent variable here was the physical activity, and the dependent variable here was type 2 diabetes.
Okay. In relation to sample size, the selected sub-cohort of 16,154 participants who were randomly drawn from a total cohort of 340,234 participants. And at the end of this study, the Interact case cohort study consisted of 12,403 incidents of type 2 diabetes cases. What was the data information gathered? Physical activity and covariates were measured by using questionnaires. The questionnaires measured both physical activity and activities during leisure time. Other variables such as baseline dietary intake, tobacco use, educational level, and alcohol consumption were also measured. Obesity, however, it was measured by BMI and waist circumferences.
Okay. The results of the study showed that physical activity was a great contributor to reducing the risk of type 2 diabetes. There were some limitations in the study in the sense that much of the data, the measurements, they came from self-report, so that decreased the precision of the actual physical activities that could have been measurable. I'm not sure if you're looking at the chart with us here, the PowerPoints, where they provided some of the correlations that come with physical activity. So some of them consist of weight loss, improved insulin sensitivity, which is very important for type 2 diabetes, improved endothelial function, and improved autonomic nervous system function. And what all of these tie in together is to reduce the risk of type 2 diabetes.
Okay. The article was particularly chosen due to detrimental effect diabetes has on the human body. The incidence is increasing in the United States in both adults and children. Therefore, with research, determining strong risk factors may help decrease rate. The article was interesting in the sense that it wanted to test the combined effect of obesity and physical activity with the incidence of type 2 diabetes. since only few studies have determined the correlation among variables.